friends. Today we are going to discuss about Dhat syndrome. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about the culture-bound syndrome, specifically Dhat syndrome. How do they present? What are the symptoms? Comorbidities? And I'll also be discussing about the female equivalent of Dhat syndrome in this video. Dhat syndrome is described as a culture-bound neurotic syndrome often seen in Indian subcontinent. In this, the sufferer attributes his debilitating symptoms to the passage of semen through nocturnal emission, urine, and or masturbation. For simple reason, in India, people believed semen as one of the 7 important elixirs or dhatus constituting the human body. The term dhatu derived from Sanskrit word. Dhatu means metal. Metal is an essential element for the purpose of body. In Vedic literature, they give description of 7 different forms of essential body elements, of which semen is one of them. And invariably, the semen has been considered to be the most important element, precious, and any loss can cause symptoms. Further, there is an emphasis for preservation of the semen. Late Professor N. Vig gave the term Dhat syndrome in 1960. Loss of semen, irrespective of the mechanism, either during urination, defecation, masturbation, nocturnal emission, and even with sexual intercourse, which results in debilitating symptoms, is considered as Dhat syndrome. As I mentioned, in the ancient Ayurvedic literature, mentions that semen to be a precious, vitality of the body, and they talk about the vivid description how semen is formed in the body. As per the literature, semen is formed by the ingested food in multiple step formation into an ultra condensation. Many culture believes that it takes 40 drops of blood to create a drop of bone marrow, and 40 drops of bone marrow results in a drop of semen. So, considering this kind of belief system, any loss of semen results in weakness. Hence, semen is considered to be a vital fluid in Indian culture. Emphasis has been given for the preservation of semen, as it is believed that is important for the maintenance of the vitality of the human body. Further, any loss of the semen causes adverse consequences on the human body. Now let's define Dhat syndrome. It is defined by any presentation of non-specific symptoms such as fatigue, depression, loss of appetite, sexual dysfunction, or any other symptoms attributed to a preoccupation with the loss of semen in urine, through masturbation, nocturnal emission, or by any other mechanism is considered as Dhat syndrome. In simple term, excessive concern over semen loss or semen loss neurosis is the word where Dhat syndrome has been given the term by N. Vig. Now let's look into the phenomenology. An important article by Grover and his colleagues in 2015 published in International Journal of Social Psychiatry. The title of the study was Phenomenology and Beliefs of Patients with Dhat syndrome in Nationwide Multicentric Study. In this study, 780 male patients recruited from 15 different centers of India, the phenomenology was studied. Let's look into the demographic details. The mean age was 28 years, and the maximum age group was between 21 to 30 years. Marital states, both married and unmarried, were equally representative. education in years was only 10 years. That means majority of them have not passed even matriculation. So, my dear friends, this demographic details clearly indicates the age group being young, married and unmarried both are affected, and only 10 years of education. If you look at the background, invariably they are from the lower middle background is the commonest, and it is present across religion. Hindu, Muslims, Sikhs were there, and both rural and urban. Invariably, the rural area had 60%, whereas urban was only 40%. So, the rural population slightly dominated the urban population. Let's look into what were the situation. The patients in this study reported of passage of Dhat. Invariably, they reported invariably during passing of stool, nightfall, while masturbation, while passing urine, when sexual encounter, or reading or watching pornography. These are the period where the dhatu was passed as reported by the clients. Now let's move into reason for passage of Dhat. The reason reported by them was excessive masturbation, that is 55%, excessive sexual intercourse, premarital sexual intercourse. These were the various reasons they have been given. Reason for passage of dhatu. Again, there are various important reasons have been given. Excessive masturbation is the 55%, sexual intercourse 24%, premarital sexual intercourse 22%, having sexual dreams, excessive sexual desires, and these are the things which have been told. Now let's look into the consequences of passing dhatu. Many of them reported feeling weakness, loss of beauty of face and body, reduction in size of penis 50%, mental illness 47%, poor erection in 62%, premature ejaculation 66%, and becoming thin, that is physique is becoming, that is the person is becoming very thin. Let's look into the psychiatric symptoms reported by them. Majority of them reported of bodily weakness 78%, mental weakness 62%, pain in the body, that may be legs, arms, joints 51%, little interest in pleasurable activities 63%, and feeling depressed 62%, trouble in sleeping 50%, feeling tired, low energy level again 67%, my dear friends. Further, they also reported of feeling bad about themselves and seeing themselves as a failure, trouble in concentrating, reading, burning micturition, excessive worry or preoccupation with the passage of semen, anger, irritability, and annoyed easily were the symptoms reported by the patients. If you look at the symptom domains across Dhat syndrome, one is affective symptoms, that is low mood, anxiety, worry. Second one is somatic symptoms, they are body aches, pains. Behavioral symptoms, withdrawn, irritable, those are the symptoms. Cognitive symptoms such as loss of attention and concentration, poor memory, pessimistic view of future, preoccupied regarding the loss of semen. This is the picture which clearly depicts of percentage of symptoms. Invariably, the fatigue or the weakness is maximum. Second one is sleeplessness, palpitation, and pain were the symptoms which have been noted in the study. Further, pathways to care. Invariably, most of them met. The Hakims or Vaidya, they are all complementary alternative medicines. Further, Unani, Ayurveda, homeopathic doctors. Further, MBBS doctors were 31%, and only 15% met psychiatrist. So, pathways to care clearly indicates before they reach psychiatrists, majority of them went to local faith healers, religious leaders, complementary alternative medicine professionals, and primary care doctors. Unfortunately, the native quacks Even now also in village advertise drugs that will increase their quantity and quality and consistency of their seminal fluid, and they cure sterility and also physique. They by these kinds of advertisements and various advertisement which are non-scientific based treatment adds to their belief system and maintains Dhat syndrome in the society. Now let's look into the comorbidity of Dhat syndrome. There was an interesting study by Sujit Kumar Kar et al. In 2021, published in Asian Journal of Psychiatry. Here, the title of the study was Dhat syndrome, systematic review of epidemiology, nosology, clinical features, and management strategies. Unfortunately, there are no large scale epidemiological studies or community studies. Invariably, we need to extrapolate the data from the clinical population. Hence, it is very difficult to know the current prevalence of Dhat syndrome. If you look at this, by the systematic review, they included 89 studies to answer those questions. In this, they reported two types of comorbidities. One is psychiatric comorbidity, which is 70%, and sexual comorbidity is 50%. If you look at the psychiatric comorbidity, depression, anxiety disorder, sleep disturbance, somatoform disorder, and stress related disorder. If you look at the sexual comorbidities, premature ejaculation, and erectile dysfunction, and desire disorders were well known comorbidities. And looking at various studies, it clearly said comorbidity is the rule in Dhat syndrome. Only 14% present with pure Dhat syndrome, that means without any comorbidity, hardly 15%. 85% of the Dhat syndrome have one or the other comorbidity. Two-thirds have depression, 30% have anxiety symptoms or disorder, 40% have somatization disorder, 50% have sexual dysfunction, and one-third had premature ejaculation. So that means comorbidity is the rule in that syndrome. If you look at the comorbidity and understand, there are somatic symptoms, anxiety symptoms, depressive symptoms which occurs in human being, and they may be attributed to the semen loss, hence Dhat syndrome. This is one way of understanding Dhat syndrome. That means the patient already have anxiety disorder, may have somatization disorder, or depression. They are unable to know why they are having these symptoms, and they may attribute to the semen loss. This is one of the way of understanding why the comorbidity is very high. On the other hand, Dhat syndrome can cause somatic symptoms, anxiety symptoms, and depressive symptoms. This is other way of understanding. However, it can become a vicious cycle and can become a debilitating disorder for a person who is suffering from Dhat syndrome. Is it a separate entity? Whether is it a culture-borne syndrome or does it require a separate diagnostic category will be discussed now. Looking at this, the presence of fatigue, having asthenia, anxiety, depressive symptoms in Dhat syndrome, many of the authors consider the syndrome is an atypical presentation of clinical depression or an anxiety disorder. Only the attribution is for Dhat. Rarely, only 15% of them present with pure Dhat syndrome without any comorbidity. Hence, can it be considered a separate entity? Or else it's a part of a clinical depression? This is still yet to be uncovered. Let's look into the scientific literature. Is it a culture-borne syndrome? This culture-borne syndrome is the word given by App PM in 1965. Here, it talks about culture-specific symptoms should be there, and it is specific to certain culture. Descriptive symptoms should reflect the cultural norms and beliefs of that culture, presents with specific psychiatric symptoms, not represented as any other psychiatric disorder, and should have some indigenous healing. Whether these four criteria are met by Dhat syndrome should be answered now. I tried to look into PubMed. When I searched PubMed for Dhat syndrome, till March 2025, there were 96 publications which exist for Dhat syndrome, 77 from Indian subcontinent and 19 articles from various other parts of the country. Hence, looking at all this, it has been considered as an Indian subcontinent disorder, which is characterized by semen loss or preoccupation with semen loss. Hence, if you look at many of the textbooks, our article starts with Dhat syndrome, which is seen in Indian subcontinent. Is it true? Is a question we need to answer. Hence, I looked into another important article published in British Journal of Psychiatry in 2004 by Sumita Pal and his colleagues. The title of the study was Culture Bowl Syndrome, the story of Dhat syndrome. They looked into whether this Dhat syndrome qualifies for culture bound syndrome. In this study, when they looked into it, the first literature which is known is from Ayurveda, that is in 150,500 BC. In Shushruta Samhita, they talk about loss of semen and vitality. Similarly, Hippocrates, Aristotle, Galen, Freud, and in Lancet 1840 and 1843, there were series of articles on loss of semen. Let's look into that. First and the foremost, Wen and Wang in 1980 also described about Shen Kui, a vital kidney deficiency similar to Dhat syndrome. Again, semen loss anxiety in Sri Lanka, which is considered as Shukra Pramahe, is the syndrome which has been explained in Sri Lanka. In Britain, in 1840, there are articles in the Lancet by Dangerfields suggested that a result of involuntary discharge of semen causing various symptoms. Similarly, in Australia, by George Bainey, published in 1857, also talked about spermatoria, which causes various mental anxiety and physical symptoms. And finally, this study reported that the Dhat syndrome, that is semen loss anxiety, is not a culture-bound syndrome and it is not specific to India. It is seen across Britain, US, Australia, Sri Lanka, Nepal, China, Australia, and various other countries. Hence, to name this as a culture-bound syndrome, it will be wrong. Hence, my dear friends, although the articles written by Indian authors proudly give credit to an NNVIG, but this phenomena has been known for more than 150 years in various parts of the world. Another study by Johnson in 2024 in the journal called as Culture, Medicine and Psychiatry, the title of the study is Dhat Syndrome, East and West, a history in 2 acts. Again, they reported about in 1870, they found that European countries discussed about loss of semen, preoccupation and anxieties. They talked about various terms given by various authors like tabis imaginaria, spermatoria, spermatophobia, imaginary spermatoria. These are the various terms have been given by European country researchers. Further, in 1895, in the University of Glasgow, dissertation on unambiguously discussed Dhat-related anxiety and its medical response to it. That means there was a thesis done in 1895. However, at present in the available literature, especially in India, NNVIG explained and gave it a name as a Dhat syndrome, and it was the term coined by NNVIG. Since it is present in various other countries, including developed and developing countries, hence it is difficult to consider this as a culture-bound syndrome. And also, you can't say that it is from Indian origin. It is present in various religion, various culture, beyond various geography. Hence, it has to be considered as a symptom which causes anxiety because of the Dhat syndrome. Fewer researchers argue Dhat syndrome is a culture-borne syndrome where people attribute anxiety and somatic symptoms for semen loss. Other researchers say that Dhat syndrome should not be considered as a culture-borne syndrome, but should be considered as culturally determined idiom of distress. However, this Dhat syndrome is an illness which the person who is suffering will be having a debilitating consequences. Similarly, there is a female equivalent of Dhat syndrome. For the first time, S.K. Chaturvedi and his colleagues published in 1993 in Niman's journal, Is There a Female Dhat Syndrome? This was published in Niman's journal. Here, S.K. Chaturvedi said the passage of vaginal discharge in females was equated with the discharge of semen for the first time in 1988. He called it as psychasthenic syndrome associated with leukorrhea. Women labeled the genital secretion as a safed pani, dhatu, or swet pradar. These are the various terms given by the woman, and also they reported of severe bodily aches and pains. Here, the woman considered the safed pani as a fluid of body equivalent to dhatus in male. Safed pani is equivalent to termed as white discharge. On evaluation of safed pani on biochemical or microscopic, there was no evidence of infection or any abnormality. It was a normal physiological discharge, white discharge. But invariably, many of the women misinterpreted for the various body vitality loss, hence resulting in female Dhat syndrome. Here, the diagnosis is done based upon non-pathological vaginal discharge. There is no medical cause can be attributed. The amount of discharge vary from scanty to needing change of clothes, and also it varies from color, amount, and type of discharge. Clinically significant distress, impairment is there because of that discharge. Accompanying somatic pains and mood symptoms are well known. The patient is concerned and tries to find treatment for this problem and considers it a serious, debilitating illness. Again, another important article by Mehra and his colleagues in 2021 in Industrial Psychiatry Journal, Female Dhat Syndrome in Primary Care Setting. Again, they looked into various symptoms. In this, the situation in which vaginal discharge was experienced, most of them reported that it occurred anytime, not in a specific time purpose, 78%. Some of them reported during passage of urine. Some of them reported during menstruation, just before menstruation, 42%, and during nightfalls or during sex-related dreams, were 46%. And many a time, whenever there is an increase in abdominal pressure also reported by the woman. What are the consequences of vaginal discharge? What did they attribute for that? Pain in genitalia is the reason for having white discharge. Weakness in body, weakness in stamina, thinness of physique, irritability before or after the menstruation, menstrual disturbances, pain in genitalia during sex, repeated vaginal infection were the consequences of vaginal discharge said by many of them. Further, what were the reasons attributed for the vaginal discharge? Eating unbalanced food is the commonest attribution given for this white discharge. Consumption of warm foods and drinks were the second one. Consumption of high energy foods, urinary tract infection, vaginal infection, constipation, excessive eating were the commonest attribution given. If you look at the symptoms, bodily weakness, mental weakness, abdominal pain, back pain, pain in the body, multiple aches and pains, headache, chest pain, dizziness, fainting spells, anxiety symptoms, choking, nausea, feeling tired, little interest in pleasurable activities, feeling depressed. Insomnia, poor appetite, feeling bad about themselves, burning micturition, excessive straining while micturition, itching around the genitalias, excessive worry. If you look at this diagram, it clearly said that in India or maybe in developing countries, because of the stigma about discussing about these issues, many of these women go to doctors, report of multiple aches and pains. That may be the reason, may be lack of knowledge, societal norms not to discuss about these issues, repressed sexual related emotions, ongoing myths, lack of access to proper health care, lack of sensitivity among the clinicians. Hence, they go to the doctor and talk about multiple aches and pains. When you see a lady who is reporting of multiple aches and pains, you need to ask about the white discharge, that is safed pani. That is, by asking this, you will be able to find 30% of the patients who have these multiple aches and pains or white discharge report of female Dhat syndrome. In this regard, there are many studies which looked into Dhat syndrome, quality of life, and disability. This is both in men and women, they have seen. This is another important article by Shahi and his colleagues published in 2021 in Indian Journal of Psychological Medicine. They looked into quality of life and disability in patient. 117 patients with Dhat syndrome were recruited. 117 matched controls were also recruited. Dhat syndrome was diagnosed by ICD-10. They looked into WHO quality of life and disability. The results were stunning. The cross-sectional study found that Dhat syndrome patient with or without comorbidities had poor quality of life and disability was high. Similarly, if they had higher psychiatric symptoms and comorbidity, they had more worsened quality of life and higher disability. That means more the comorbidity, the poorer is the quality of life and disability. To conclude, my dear friends, Dhat syndrome can be considered as a culture-bound syndrome. But however, at present, the literature indicates it's not a cultural bound syndrome. It can be considered as an anxiety disorder. A similar to Dhat syndrome, an equivalent to female Dhat syndrome is also present. They say because of the passage of white discharge, that is safed pani, vital fluid from the body is lost. Hence, equivalent to Dhat in male results in various bodily pains and weakness. This Dhat syndrome is present across culture, across geography, religion, and timeline. Comorbidity is the rule in Dhat syndrome. 2/3 of them have psychiatric disorder, 50% of them have sexual dysfunction, poor quality of life, and disability is reported. 1/3 continues to have diagnosis of Dhat syndrome in follow-up. There is a need for research on this phenomena of Dhat syndrome. In the next video, I'll be discussing about the assessment and management of Dhat syndrome. Thank you very much for giving your valuable time. Stay safe.